Welcome, everybody. Thanks for being here and thanks for taking time out of your day. The whole purpose of this webinar is just so you can get a feel for if looking into a vision correction procedure is something that you would want to pursue further or not. And just for you to learn a little bit more about the kind of problems that we solve here every day at the Laser Eye Center to help people see better. So while Sharif is working on that, I mean, the general concept here is just in 2025, it's really not far-fetched to be able to wake up in the morning and not have to reach for the nightstand to grab your glasses, just to be able to start your day, or to be able to drive to a restaurant and drive to the restaurant, and then when you arrive, actually see the menu without having to put on readers or bifocals. And I mean, just typical things that people do. If you're sitting on your couch, to be able to watch TV and also look at your cell phone. I don't think I'm the only person who does that, but these are the things that we solve here every day. And Sharif, it looks like you just might have gotten the first slide up, so I can give it back to you. But we're going to be talking about modern vision correction. And Sharif, why don't you go ahead and I'll just continue after you kind of do your intro.
Absolutely. And let's see if this works. Do you see it now full screen, Dr. Bindi?
I can see it. I see Greg
Perfect.
Pop and Cameron. Yeah.
When we think about who it is that has modern vision correction that undergoes it, it's professionals like Greg Papa and who's an announcer for the 49ers, Cameron Brink, who's now in the WNBA after a star season, number of seasons at Stanford. It is people who are adventurers like this gentleman, Yoel, who does a lot of things outdoors. And it's also people like us, the rest of us. What I want to do is share with you just a story of just one of the many patients that comes in. And what you're going to see here in this quick video is a gentleman waiting for his wife as Dr. Ling completes custom lens replacement. Oops, that didn't work. Let's try it again. See if this works.
I've got everything video. I love you. So Christine, how was that for you?
So easy, very, very easy, simple, felt nothing the entire time, just a great process.
Get in the middle here, come on.
Yeah, let's get a little.
We're gonna have this forever.
All right, awesome.
Okay.
Well, thank you for letting us take care of you, Christine. We're gonna see you tomorrow morning.
Yes.
We're gonna see you tomorrow morning.
Okay, absolutely, Doc.
All right, you take
You're
care.
awesome.
Thank you.
God bless.
I think I speak on behalf of all the employees at Laser Eye Center that this is why we do what we do. It's those kinds of moments and just seeing the joy in people who have a procedure with us and their family members who are typically waiting for them. And on today's webinar, we're going to learn a number of things. Among them, we're going to talk about what this whole category of procedures is all about and how this differs from traditional vision correction. We're going to help you understand if you're a candidate, and we're going to describe the different procedures so you might get a sense of which procedure would be best for you. We are going to talk about recovery. We're going to talk about some possible side effects, and we'll talk about cost and whether or not this is covered by insurance as we round this thing up. I expect us to be on for about 40 minutes. Again, feel free to submit questions. I see that people are already doing that. We'll answer them as we can. And with that, I'm going to hand it off to you, Dr. Bindi. I'm going to put up this slide so we have a this quick anatomy from you.
Well, good. So, I mean, what you're seeing there is it's a diagram of an eye. You can see light coming in from the left-hand side. It passes first through the cornea. We'll talk about the cornea. That's where we do laser vision correction. Next, the light passes through the lens. That's that structure in the middle. If Sharif, you can do your cursor on the lens.
Yep.
And then the light is focused on the back of the eye, the retina, and from there, it's the message is received and transmitted out to the brain, and we call this process vision. Now, most people will have some degree of a focusing problem, and this is why they wear glasses or contacts. If they're nearsighted or farsighted or have astigmatism, the light, as it enters the eye, it's not clearly focused, sharply focused on the retina, and the patient will just perceive blurry vision. And so for hundreds of years, people have worn glasses or contacts to correct focusing problems, such as nearsightedness and astigmatism, and those work great. We actually refer to glasses and contacts as vision correction 1.0, and that's what probably a lot of you on the call right now do. And then in the mid-90s, the FDA approved laser vision correction, kind of the earliest versions of LASIK, and that's where we could use laser light that could reshape the front of the eye, the cornea, and that could also treat nearsightedness, astigmatism, and farsightedness as well. And so we refer to kind of the earliest versions of laser vision correction as Vision Care 2.0. And so today, the focus of what we talk about will be modern vision correction. And we think of this as Vision Care 3.0. And these are the most modern, most advanced versions of these vision correction procedures. So people don't need to wear glasses or contacts. So my area of expertise, what I base my career on, has been laser vision correction. So this is all laser LASIK, modern epi LASIK, and smile LASIK. And then we'll also talk about CLR and Evo ICL. Um, so right there, I guess what we're looking at, if you can see, this is a picture of the laser we use every time we do LASIK. And so what you can see on the left side, there's a bed attached to a laser, and when people have LASIK, they lay on the bed, their head's in the headrest on that image on the left. And when they look up, they're able to see that image you see on the right. So that's what a patient can see during the laser treatment. Um, all in all, the patient's in the room about 15 minutes. And as the patient's having the treatment, you can see that green flashing light. Um, the laser treatments take about maybe 10 to 15 seconds to correct vision, but the patient's in the room for about 15 minutes. And so if you've heard your friends who have had LASIK before, they'll say the procedure takes 15 minutes. It doesn't hurt, and it's an overnight recovery. So the next day, people can resume normal activities. Again, since these are laser treatments, there are no IVs, there's no injections, there's no blood, there's no blades. These are just laser treatments, and
That's right.
that's the LASIK. Okay.
Let me transition over now to you, Dr. Koushik, and welcome. Welcome to the webinar. And I want now for you to talk about another procedure that is appropriate for people who are in that age range for LASIK. And you know that as the Evo ICL. And I'm going to bring up that slide in just a moment.
Sure. Yeah. Thank you so much, Sharif. Thank you, Dr. Bindi. Thank you, Dr. Ling. Great opportunity here to discuss Evo ICL. ICL just stands for implantable Collamer lens or implantable contact lens. And so you can kind of imagine it just like that. You put a contact lens on your eye to correct your vision, and you have to take it off at the end of the day. With the ICL implantable contact lens, we put this contact lens inside of your eye and you don't have to worry about it anymore. You don't have to think about it. You just wake up and see, you go about your day. And so it's something that you don't ever feel, you don't ever even perceive later on that something was then added to your eye. But it corrects your vision and it lasts for decades and decades. Now, this might be a procedure that would be a better option for some patients because they have a higher prescription and doing conventional laser vision correction for them might not be the best option. Or they just have thinner corneas, so the anatomy of their specific eye might lend itself better to doing this implantable contact lens. So we do a comprehensive exam to make sure that this is the best option for you, and we talk to you about the benefits of Evo ICL. And as everyone on the panel knows, I do have Evo ICL on my eyes, and I've definitely enjoyed having that and being glasses and contact free. And I can never feel it at all. I can't tell that I've had it. No one can tell when they're looking at me that it's there. But you can see in this slide just how small it is, and where it sits behind the iris, the colored portion of the eye, and in front of the natural crystalline lens that we're all born with. So it sits right in that location, corrects your vision, and you don't even have to think about it.
And Dr. Koushik, can someone, if someone was looking at you because you have this lens in, could they see the ICL in your eye?
No, I mean, I think that's one of the beauties of it is no one can just know and look at it. I think it's important to note that a health professional, an eye doctor, definitely when looking with their microscope, can see it, and that's important because as you continue to get care throughout your life, they'll be able to see that you had that and make sure everything looks great. But the layperson just looking at your eye cannot see that it's there.
Right, great. Well, now I want to transition to you, Dr. Ling, and we're going to talk about another procedure that we do, custom lens replacement. I'm just going to bring up the slide to help set you up. Okay.
All right, thanks, Shuri. And thanks, Dr. Koushik, for introducing ICL. And thank you, Dr. Bindi, for talking about laser vision correction, as well as laying out, I'd love that analogy, like vision correction 1.0, 2.0, 3.0, modern vision correction. And this is a good segue into CLR. So kind of looking at the whole dynamic of modern vision correction is that there isn't a single procedure that's perfect for every person. Everyone has their own unique anatomy, their own unique needs in terms of farsightedness, nearsightedness, astigmatism. having had previous surgeries, someone mentioned RK or previous LASIK in the past, and there's also that age component factor that needs to be taken into account because our vision changes as we age. New problem can arise, such as the need for reading glasses, which wasn't an issue before, the development of cataracts. So that's what I would like to introduce custom lens replacement, and Sharif has it pulled up here. So custom lens replacement is simply another tool in the modern vision correction armamentarium. And let's understand a little bit about what custom lens replacement is. So inside our eyes, there is a lens. And on the screen here, Sharif is playing a video of this lens within our eyes that we all have contracting and expanding. It's a beautiful mechanism that we are all born with, but also, unfortunately, over time loses. And so what is this expanding and contraction doing? It's actually focusing for you so that when you're young and whether you needed glasses or not, with that single pair of glasses or just the great vision you were born with, you could see far and near, something that we have taken for granted for until we reach our 40s. For some people, it's either in their early 40s or late 40s, but most people notice some changes as the lens stops expanding and contracting. We call that accommodation. They start noticing the loss of that. And when you start to notice that, you start to realize you have to hold things further away or put on reading glasses, adjust lighting. All these things that used to be so easy are becoming more and more difficult. And the enjoyment of simply just going to a restaurant or in something off the menu in a dim light setting may become a challenge. So what's happening to this lens? Well, it's aging, and an aging lens hardens up. And you can see here on the slide on the left-hand side, you got that normal lens, light goes in very well focused, and it can dynamically expand and refocus depending on how far things are. And on the right-hand side, you see the aging lens, which kind of has a yellowish hue to it, and that light going through it is scattering quite a bit. So quality of vision is affected by age-related changes. And then the focusing and contracting of that focus also becomes rigidified, not responding to the on-demand refocusing that we have enjoyed. The end stage of this aging process results in a cataract. So that's what a cataract is. But cataract doesn't just show up on day one. In fact, it's a gradual process that starts, again, in our mid-40s. We term that process dysfunctional lens syndrome. And it's only towards the end of that process then we term it a cataract. So as you can now put together, it's a spectrum. It's a spectrum of how our eyes change and age throughout your life. And depending on where you are in that process, when you come in for an evaluation with Modern Vision Correction 3.0, we figure out where you are in that process, and it may either be LASIK, modern LASIK, laser vision correction, which will still work very well for you, and knowing what to expect, how long it'll last, or it might be ICL, or it might be custom lens replacement, in which we directly address this aging lens. Now, aging lens and treating it directly with CLR is a condition that you want to figure out what the timing is, because the reality is a natural young lens will always outperform a customized synthetic lens. So there is a threshold that we want to see you cross in which we say with very high degree of confidence that, oh yeah, when you do CLR, you're going to recoup a lot of the functions that you have lost with this dysfunctional lens syndrome.
Let me turn it over to you, Dr. Koushik, because the questions coming in. One of them is, will I still need cataract surgery in the future if I were to have CLR now?
Yeah, no, this is a great question. And thank you, Dr. Ling, for nicely explaining the anatomy there and how the lens is changing. So the answer to that question is you will not need cataract surgery after having a custom lens replacement. And we have to think about, what we just did with the custom lens replacement. Like Dr. Ling mentioned, you have this dysfunctional lens, and it's a process, it's a spectrum. It's gradually getting worse. This might be year by year. And it eventually, at some point, we call it a cataract. Now, if we act when it's starting to have this dysfunctional process, we preemptively are stopping this process of the cataract from forming. And this artificial lens that we put inside of the eye does not go through the kind of processes that the natural lens went through. So you will not develop a cataract, and the natural lens that's removed and replaced with this artificial lens will last you the rest of your life. The artificial lens is fantastic, and will not undergo any kind of degradation like that. So it's a wonderful benefit to not have to do cataract surgery anymore once you've removed it with the CLR.
And Dr. Bindi, we have a question about, can I have, if I had LASIK at Laser Eye Center, probably with you years ago, can I have custom lens replacement?
As long as all the other measurements are okay, that's a fairly common scenario, actually. I know I do see somebody who wrote a question, and I know on this webinar, there are a lot of people that I did LASIK on 15, 20 years ago, and then they went through the aging process, and now they're starting to feel like it's getting more difficult to read. Maybe they're starting to use reading glasses again. And so in that scenario, that's where we say during the consultation, what would make sense? Sometimes we'll say a laser treatment could make sense just to fine tune things a little bit. But if the lens is actually changing, it's further down that process, that's the point where a laser treatment probably is not going to be the best treatment. And we talk more about lens options, and that's where CLR comes into place. And remember, what CLR can accomplish overlaps what LASIK probably accomplished 20 years ago for these people on the call. When we do CLR, it can fix distance vision, so people can see better far away. It can fix near vision, so you don't need readers and bifocals. And then, like Dr. Koushik was just saying, you never develop a cataract, and that's considered permanent because that lens implant is an inanimate object. It doesn't age or change, and so that's one and done. So it can definitely be done if someone's had LASIK in the past.
And we're having a lot of questions about CLR. So, Dr. Ling, how long has CLR been around?
Yeah. So let's go over what CLR, custom lens replacement, actually is. I guess we haven't really touched on that in detail yet. So as the name suggests, custom lens replacement, you're replacing that dysfunctional lens that we just talked about, and perhaps it has already progressed to a cataract. We're going to replace that cataract. So you may have also heard of a procedure called cataract surgery. So CLR and cataract surgery share a lot in common, but the differentiating factor is you don't need to wait until you develop cataract to get your lens replaced. So think of custom lens replacement as a very high level of cataract surgery, but which can be done even if you don't have a cataract yet. So that process of CLR just involves removing the dysfunctional lens and replacing it with a synthetic lens. And those synthetic lenses are called intraocular lenses, IOL. These can also be used in cataract surgery. Here, Sharif has pulled up IOLs, different various types. And so custom lens replacement, if you just look at it as similarly as cataract surgery, we've been doing this for the past 60 years and has evolved remarkably, both in terms of safety and technology, and the technology being how we perform it, as well as the IOLs that support the outcome.
Right.
So that essentially is what custom lens replacement is.
And let's talk a little bit about the procedure itself, which we do here in our state-of-the-art facility. Dr. Ling, could you just take us quickly with kind of what to expect when you arrive, how long it takes, et cetera?
Yeah, so modern lens replacement procedures take about 10 to 15 minutes for each eye. It is a painless procedure. It is an outpatient procedure. In the grand scheme of the medical procedure, you could get custom lens replacement cataract surgery. They're one of the most commonly done procedures in the world. About 4 million are done each year in the United States alone, I believe. And the recovery is also a remarkably quick process. So kind of summing it up, 10-minute procedure, comfortable, painless, just looking towards a bright light. Once you're done, you walk out. Just like the video that Sharif showed you, the woman that I performed CLR on just walked out with a pair of sunglasses, and her husband will drive her home that day. And then she's going to get a good nap in. And then when she wakes up the next morning, vast majority of people are already noticing that the vision has improved dramatically. And in terms of getting an idea of when life can kind of resume its normal routine, we tell most people they may be able to return to work after about 5 days.
Dr. Koushik, why is it that this doesn't hurt? Because people say, does it hurt? Does it hurt? And Dr. Ling said it's painless, but could you help people understand why it's painless?
Yeah, sure. So we can take a little brief discussion about the anatomy. The lens that we're removing, that dysfunctional lens, It doesn't have a nerve supply. There's no nerve endings there. So when you look at things that cause pain, we look at it because you have a nerve supply there, and the nerves are responding, and you're feeling that sensation of pain and discomfort. The lens, thankfully, there's no nervous tissue there. There's no way for the lens to actually send you signals that there's pain. So that's a huge benefit in terms of when we're removing it, there's nothing there to signal that there's any pain. We also take great steps to make sure you're comfortable. You know, we do use numbing medication on the surface of the eye, as well as some numbing medication inside the eye, and that makes you comfortable and relaxed and allows for a really pleasant experience. So it's a combination of factors that really help the patient get through this process that's very quick, relatively, and also pain-free.
Dr. Bindi, is this similar or different from what we do in the LASIK surgery room?
Good question. I can see in one of the chats, someone said, how involved is this process to go through? I think from a patient's perspective is what she's referring to. And well, if someone's familiar with LASIK, generally when people have LASIK, they'll say something along the lines of LASIK takes about 15, 20 minutes to perform. It doesn't hurt and the recovery is quick. And CLR and Evo ICL have really mimicked the LASIK experience. So CLR and Evo ICL, these are procedures, outpatient procedures done in our clinic, similar to LASIK. They don't hurt. Overnight recovery to resume activities within the next couple of days at least. So these are pretty easy procedures for someone who's familiar with LASIK or has had that. It's kind of on par with that. It's one of the things that at the Laser Eye Center, we saw what people would go through with LASIK, and people would say how easy it was and how quick. And then we saw how cataract surgery done in hospitals just seemed like a whole different process altogether, where people would go to a hospital, they'd wear gowns, they would have to find a new place to park and all new people. And so what we really tried to, as we evolved over the last several years, working with Dr. Ling and Dr. Koushik, was we wanted CLR to be as LASIK-like as possible. And so all of our operating suites, they're right in our office with the people that you've already known, the people we work with every day. And there's no need to do anything other than just come to our office, get your vision fixed, arrange for a ride home, and the next day is when people start to feel like they can see the benefits.
Yeah. And I want to touch on this. Dr. Ling, here's a question. Will CLR give me 20/20 vision for the rest of my life? I have astigmatism and am farsighted. How do you answer? Because you've been
Great
asked
question.
that many times.
A very commonly asked question. So it all depends on the consultation process, what we find. So astigmatism, myopia, nearsightedness, farsightedness, those are all numbers on a prescription pad that can be translated into, say, a pair of glasses. And if those numbers correct your vision to 20/20, that tells us that absolutely custom lens replacement, which is just another form of correction through an IOL, can be used to correct for your vision. But we're professionals. We know that vision is complex. We will evaluate, when you come into our office, evaluate millions of data points here, in which we will understand what are some pre-existing conditions that you may not even have realized that you may have, that we'll pick up on and put it in context, both in terms of your overall eye health and also your visual potential, both now and into the future, and whether we would recommend CLR for you and to what degree can you expect your vision to be.
Great. And kind of a related question to you, Dr. Koushik, around Evo. I've seen things like, is this the latest version of the Evo ICL that you're using, or using an older generation? What can you expect from Evo ICL in terms of how quickly? And you're the perfect person to answer that because you have them.
Yeah, so good question. I think Evo as a piece of technology is implantable columnar lens, and as we mentioned, implantable columnar lens or implantable contact lens has been around for a long time, decades, and so it's gone through different generations and different iterations, perfecting this formula about how to get the ideal lens to correct the vision and help patients see well. And so yes, we use the latest version of the Evo ICL, and that's through the company Star Surgical. And so we use that technology, and we make sure that all the details in our exam with you match up to make sure that Evo will correct your vision to the way that you want to see, to have that good quality of vision, to just wake up and see. and improve all aspects of your vision. If there's anything we notice on a comprehensive exam that would limit your vision, of course, we would let you know, and then we would be able to workshop those things with you. But in terms of direct technology, yes, we're using the latest version of the Evo ICL.
Great. Dr. Bindi, what are the risks of the LASIK procedures? And then Dr. Ling, I'm going to go to you to answer the same question about lens.
When people do LASIK, the most typical symptom is dryness. So especially the first 4 to 6 weeks after, since our natural tear production decreases and it takes usually a month or two to bounce back up to normal. So people use lubricating eye drops so their eyes feel more comfortable. If someone has pre-existing dry eyes, I guess it can take a little bit longer than that, but 4 to 6 weeks is a good ballpark range for most people. A retreatment is a concept. Let's say it wasn't quite 20/20. So the only goal here is so people love their vision and they can see great and they can see at least as good as their glasses or contacts. Between 2 and 4% of people might say one of their eyes is not quite 20/20. So we give it about 3 months time to let it settle and stabilize. And if it's perfect, we're done. 2 to 4% of people will fine tune to get a little bit more clear if we can do better. Halos and glare, especially if people, the older versions of LASIK were definitely more likely to see halos or glare as a side effect. And even if they could resolve with time, that was a pretty typical thing. But now with modern technology, it's pretty rare actually. People usually see at least as good as their glasses or contacts. Larger prescriptions, larger pupils, sometimes it's a little bit more likely. Infection is 1 out of 10,000, so we have people using antibiotic eye drops. So those are the typical side effects that we can see.
And Dr. Ling, how would you just add to this in terms of lens procedures?
Yeah, so in terms of lens procedure and just vision correction surgery overall, these are elective surgeries. We have the utmost highest standard in terms of safety to be in place in order to be offering these procedures, because these are things that you choose to do, not because you have to do. So we already have a very good understanding of, and typically what the safety margin is, and they're quite good. Cataract surgery or custom lens replacement in the way that we do it has one of the highest safety ratings in terms of any procedure you do. But nonetheless, they are surgery. So Dr. Bindi already mentioned that, there's a risk of infection, 1 in 10,000. I believe that, for one of the studies that we looked at, infection rate is like 0.14%, extremely low. And what we really spend most of our time on in terms of the consultation process is picking up pre-existing conditions or things that may affect your outcome from the surgery, or simply tell you, hey, this may not be the right time to do, option A, or maybe option B would be preferred. So we're very conservative in our approach in recommending certain procedures so that the result of the surgery for you who are a candidate would be just dramatic. So both in terms of visual outcome as well as safety. So we will work on that with each individual to maximize their outcome and minimize the risk.
Thank you. And I'm just going to put up a slide here and ask Renee to get ready to come on screen if she would. This just shows you that our 3 surgeons, I say what, we take our own medicine, we eat our own cooking. All 3 of our surgeons have had one of the modern vision correction procedures. Dr. Koushik, Evo, Dr. Bindi, LASIK, Dr. Ling, Smile. I myself have had Epi-LASIK, PRK, just over 30 years ago. And I want to introduce Renee, who's been answering questions in the background. Thank you so much, Renee. You've had custom lens replacement. And so amongst the 5 of us on the panel, we've covered the entire range of the procedures performed at Laser Eye Center. What was it like? What were you struggling with? And what's it been like since you had CLR?
Yeah, sure. I was struggling with my vision. I was needing to wear glasses almost all the time for almost all the things, whether I was playing tennis or reading or driving or looking at my computer. And it was really frustrating. And I was not a great candidate for LASIK, sadly. But, I've been hearing about custom lens replacement, wanted to learn a little more about it, came in, got my consultation, determined that, yeah, I could be a good candidate for CLR. And, I went from needing glasses. I really couldn't leave my house without them. And I had probably 5 pair at any given station to leaving my house with 0 glasses. And, I might need a pair of +1 readers every once in a while if I'm doing some real small print. But otherwise, I am virtually for all my functional vision, I'm glasses free. And so it's been just about 3 years now. And, you know, I've made some good decisions, but this is definitely at the top.
Awesome. Thank you. And Renee is one of the team at Laser Eye Center. She's one of our counselors. Some of you will meet her if you come to our Pleasanton location, but I think somewhere around half of our employees have had a procedure, of everyone, the technicians and front desk team and call team. And we're really proud of that. And most of the others is just because they're not a candidate. They have great vision. They don't need to wear glasses. So we believe strongly in the procedure. And Dr. Bindi, there are a lot of questions coming in about, you know, I'm a -5, am I a candidate? Or I have floaters, am I a candidate? And what is it that people need to do? And you know, I'm putting the slide up here about our AVA.
Right. Well, the first step is really, if somebody says they're interested in seeing better, the first step is to book a consultation, one of these free consultations at our office. And that's where we do what's called the advanced vision analysis. And in that process, it takes about maybe an hour, hour and a half. And we get over 1 million data points, and that's where we can really that's really what informs us, so we can see would it be safe to do a procedure or not. In my experience, about 80% of the time, all the measurements line up in a normal range, and people can do a procedure. And then about 20% of the time, we will uncover a reason where we say it's actually preferable to hold off for now. And so we offer conservative advice about which procedure is going to work best for them. And so the advanced vision analysis is the first step, and that's where people would come in to one of our offices, either in San Jose, kind of by Santana Row area, or in Pleasanton by Stone Ridge Mall. And that's where they'll meet firsthand with the doctor to explain these things, and then we can give them a clear suggestion. They can decide if they want to proceed.
Yes, and you know, we offer multiple ways for people to come and learn more about this after this webinar. As Dr. Bindi mentioned, our 2 locations conveniently and right off the freeway in San Jose and Pleasanton. Also, some people want to have a virtual consultation, kind of a meeting like this over Zoom or over telephone with one of our counselors, and we'll spend up to 30 minutes with you discussing your goals, talking about procedures, talking about pricing. And others of you say, hey, I really just want to understand how much this costs, and do you offer financing? And we offer a 15-minute phone consultation to be able to handle that. And right on our website is where you can schedule all of these, and you just give us your name and email and phone number and tell us the best time to reach out to you. And one of our team will be glad to do that and spend the time with you so that you can understand, how do I make this affordable for me? People often ask, well, what are the prices of this? LASIK is around $6,000 for both eyes. The Evo ICL is around $10,000 for both eyes. And custom lens replacement is either $14,000 or $16,000 for both eyes, depending on whether or not we need to use something called the light adjustable lens. All of that gets discussed after you've had your measurements, because as someone said, hey, I'm a -5, you know, am I a candidate? Well, you know, maybe, right? Dr. Ling, when someone sees you on the street, says, I know my contact lens prescription, I'm -5, can you do a procedure on me? How do you respond to them?
So just like what Dr. Bindi said, 80% chance that you'll be a great candidate, because we can treat numbers, right? We treat the numbers, but whether your anatomy, the stage of life you're in, your needs would match up with that procedure. You know, we have, you know, 5 major procedure types. Perhaps one of those can be recommended for you, or we may see that, hey, there's certain things that may disqualify you, or there are certain things you need to pay attention to. So the main thing is we look at and evaluate the whole package here for you.
It's interesting also. It's a very common scenario, I would say probably every day that I do consultations, where people come in, they will have done their research and they've been online, and they'll say, I've studied it and I know I want to do SMILE LASIK or something like this. And I'll say, well, you're farsighted, and SMILE doesn't treat farsightedness. So we give a suggestion what's going to fix their prescription. Or other people, they'll say, I drove all the way from the Reno area because I want to have CLR. And we'll say, well, you're 26 years old. There are other treatments. And so, like I say, the first step is to come in and we can sort through and streamline which procedures are going to be safe and appropriate. And it's really based on the measurements and the data and our experience. We can give people a clear-cut suggestion. Often it lines up with exactly what they wanted, but they'll learn the facts and find out if they want to proceed. Yeah.
That's great. That's great. Well, as we start to kind of wrap up the webinar, we've answered many questions. I will tell you, after Dr. Ling and Dr. Bindi leave because they need to get into surgery, Dr. Koushik, who's got a little more time, is going to stay with me after the webinar. We're going to continue answering questions. We think of that as the after party, and we'll stay on as long as we can before Dr. Koushik says he's got to get back and see his next patient in afternoon clinic. But I just ask, let's kind of have some closing comments here. And what you have on the screen is once you enter our lobby in San Jose, we like to feature patients. We like to celebrate with our patients after they have procedures. And you can see here, these were all people who wore glasses until they didn't. And Dr. Bindi, why is it that people have been coming to see you now? Gosh, well over 20 years. We've been around about 25 years. And why do people come see you and come see us at Laser Eye Center?
Well, people come with a problem. They don't like that they need glasses and contacts, and I think they've talked to their own friends and family members who've had their vision fixed. And I think people go word of mouth referral. They go where they trust. And after doing, I personally have done over 70,000 of these procedures, and so just over the years, we've seen a lot of people. We know when to say this is something to avoid, when is it something to do. And the goal is so people can just simply wake up and see, and we can see if that's realistic. Usually it is. And then the other thing is, just kind of building on what Dr. Ling said, is we never try to forget what we're trying to accomplish here. And we want people to see great, but this is a safety first kind of a thing, where if we think it's not safe, it's not a good fit, or glasses or contacts are more appropriate, you're going to hear it come out of our mouths right away, okay? So if everything lines up as a straightforward option after you learn your options, I think people can feel confident that this is going to be a good option, and we can explain pros and cons depending on your unique situation.
So, Dr. Ling, what is it that, as you think about what you do every day, what is it that gets you most excited?
Yeah, the most exciting part is just helping someone realize the full potential, in their everyday life, things that they couldn't do before because of their vision or their dependency on contact lens or glasses, or realizing that, they were so preoccupied with that need for glass or contact lens that they couldn't engage in something they always thought of, or that now their life is just much simpler and they can enjoy it to the fullest. So, the communication up front in the consultation process, we get to know each other. This is a very much, it's a given that we're all experts here. As a surgeon, doing the surgery is actually, easy for us. Communication is the most important part actually here. And we're all great communicators. Hopefully that comes off here in the webinar, is figuring out what's the great plan for you. What are your goals? Can we match them and meet your expectations? And then just carry and execute and celebrate together at the end. So that's what brings me joy every day.
Right. And Dr. Koushik, you, as with Dr. Ling and Dr. Bindi, you have dedicated your career to this, to the exclusion of doing other things you could have done in medicine or even ophthalmology, like manage glaucoma disease or retinal disease. Why'd you do it? Why'd you decide to become a refractive specialist?
Yeah, I think echoing a little bit of what Dr. Ling said, I think there's no greater feeling than seeing patients after doing a procedure and seeing the smile on their face, seeing what they're capable of doing now without glasses and contacts, the ease at which they kind of navigate through their life. I think all of us see patients who it's a frequent statement. Oh, I have, 3 different pairs of glasses, and, I use this one for this activity, this one for this activity. And slowly over time, it's become a burden. And so to kind of help patients relieve that burden, get them back to doing what they love, there's no greater feeling than that. So I think that's what drew me the most to this field.
It's interesting. Afterward, the most common comment that we hear after the surgery is, "It's the very best thing I've ever done for myself." And even though I've heard that tens of thousands of times, I think that's the feeling that people get after this when they can see better.
Well, Dr. Bindi, we've heard this described as an investment in yourself, and I think that's really true. Having been a part of the refractive surgery community for many years, I'm just so proud to be part of this team, because for all of you watching and listening, we want the experience that you have with us at Laser Eye Center to be as exceptional as the great vision that we aim to achieve for those of you that we perform procedures on. And we want this to be different than the typical going to the doctor's office. And I think you'll notice that right when you walk in our front doors. And here you see Sarah on the screen. And she's just one of our lovely teammates. She is the one that administers eye drops to people before they're having custom lens replacement or ICL with Dr. Ling in San Jose. And we get comments back and people write reviews and they often mention Sarah. And it's just an example of how our entire team operates. And we ask people after they come in for a consult to rate their experience with us and to tell us where we've done well and if we've fallen short. And we take all the comments seriously because it's really about you at the end of the day. And we have this motto that it's Dr. Bindi came up with years ago. It's just about, why do people have this done? It's because they want to simply wake up and see. And that's really what everything's about here. You are welcome to send us questions. You can call us. You can go to the website, reach us that way. We're here to help you. I want to thank everyone for joining today. Those of you who want to stick around and ask more questions, we're going to do that. Dr. Bindi, Dr. Ling, I promised you we'd get out by 12:45, so you can have a minute before you get back into surgery, and it's 12:44. So I want to thank each of our surgeons. I also want to thank Renee, who's been diligently answering questions in the background, and anyone's questions we didn't answer, we'll make sure we follow up with you by email. Lastly, I want to say that next week, you will be getting a text from us with a link to the recording of this webinar. You're welcome to go back and watch it again and share it with family and friends as you kind of think about whether or not modern vision correction is something that you want to pursue further. Again, thank you so much. I hope everyone has a great rest of the day and a wonderful weekend. Bye-bye.